This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next guest is physician's assistant Mandy Warner. She's a PAC in orthopedics at OPA Ortho, talking about femoral shaft fractures. This would include something like Brooke Shields did, right, Shannon?
Yeah, Brooke Shields sustained a femoral shaft fracture. Say that 10 times. Femoral shaft fracture. Anyway, yeah, so, that femur bone is huge. And when you fracture that, a lot of times you need surgical intervention. And Mandy's going to talk about repair, return to function, and some of the complexities. So excited to talk to Mandy Warner.
Let's get that conversation going. Here is Mandy Warner and Shannon O'Kelly.
Mandy, how you doing?
I'm great, thank you. Happy to be here.
Happy to have you. Thank you for joining us here on Health Talk. You're a physician's assistant.
Yes.
I want to talk about you, your training, your background, and also talk about your practice and what you do in your practice. What does the day in the life of Mandy Warner look like? So let's talk about you and your training. Why a physician assistant? How did you land where you are right now?
That's a great question. How did I get here? It started out, I guess I've been an athlete. I've always been interested in the human body. Took a lot of college courses in exercise science and thought maybe I'd be a physical therapist or athletic trainer, but then kind of found that I really loved surgery. And physician assistants have a wonderful ability to assist in surgery. And being an athlete, it kind of landed me in the orthopedic field, having lots of injuries and myself and surgeries and such to get me back out there. I really wanted to be able to provide that for people and help them get back to their passions and hobbies and sports. So that's kind of how, long story short, I got here after I did a lot of other things in life, traveling, sailing, to learn that I wanted a career, but here I am. And
you grew up in the Northwest.
I grew up in the Northwest, Silverdale, Washington. Yeah.
Silverdale, give big shout out. Big shout out for Silverdale. Where'd you go to your undergrad, your education?
Yeah.
It sounds like you were an athlete. It sounds like you had some injuries. It's always fascinating to talk to people, honestly, whether you're in physical therapy, whether you're a physician assistant or a doctor. A lot of us were exposed to the field or profession because we were injured and someone helped us. And I think that's what my passion is. I'm sure that's your passion is helping someone get back to kind of what they love to do, whether it's athletics or walking or hiking. But tell me about your education.
Yeah, certainly. So I did my undergrad at the University of Puget Sound in Tacoma, Washington. So go Loggers,
There we go.
I was a rower there. I walked on the team and had 4 awesome years as a varsity rower. We went to nationals every year and just did awesome things. It's a beautiful sport if you ever have the opportunity to do it. And then was dabbling in triathlons, kind of on and off after that. Was weightlifting in the gym one day and dislocated my shoulder and needed a shoulder surgery. And Dr. Chris Wall fixed me right up. And it ironically was right before I was supposed to go to PA school. So it just kind of like solidified my decision of, I really loved like learning how that surgery went for me and how it was going to go. And here I am now helping the same people, that have the same injury.
Yeah. And so what is your role as a PA working with your team? You talk about surgery. Are you in the OR?
Yes.
Are you helping pre-op, post-op, during surgery? Wow, that sounds like a pretty cool job.
It's very cool. So I work with Dr. Laura Matson-Coe and Dr. Kevin Coe at OPA Ortho in downtown Seattle. I'm lucky to work for both of them as husband and wife, and they provide a very fun and cool dynamic because of their personalities, but also they do very different things. So I work mostly in surgery with the two of them, assisting in total hip and knee replacements, total shoulder replacements, clavicle fractures, proximal humerus fractures, like all these different elbow conditions. And then I see the patients in the hospital after surgery, and also post-op and pre-op is kind of the big role I have now. And I'm working on getting better and better at my injections so I can help do some of those as well.
It sounds like a very satisfying job.
Certainly,
I mean, you've got to like what you're doing when you see the patient from start to finish, and you're kind of involved in that process. That's the joy of being in healthcare. At least the world that we work in, whether it's physical therapy or being a PA in an orthopedic kind of environment, is watching someone that is probably, struggling and is probably sad or not very happy because they've lost their functional ability, whether it's weightlifting and tearing your shoulder out, but helping people get back to that. And one of the big things we want to talk about today is a pretty serious fracture, and that's called a femoral shaft fracture. And how are you going to treat it? What's the intervention? How do you fix it? What's the outcome? So we're going to take a break real quick, and we're going to come back. And we're going to get into those nuts and bolts, so to speak. Okay, Mandy?
All right, sounds great.
More with Mandy Warner and Shannon O'Kelly right after this time out on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
Our conversation on the femur and fractures continues with Mandy Warner and Shannon O'Kelly.
Mandy, again, thank you for joining us, Health Talk. Thank you for setting up and telling our listeners and myself about your experience, your background. Pretty serious injury we're going to talk about. This is a femoral shaft fracture. This is when pretty traumatic blow, fracturing your femur is big stuff. It's a traumatic event. Tell us how it happens, what's going to happen, surgery, intervention, all that neat stuff, and return to activity, whatever that might be. Let's take it from the start.
Yeah, certainly a big topic and one that has many moving parts and is very variable. But sad to see someone like Brooke Shields fall and break her femur like that. That's not a good injury for anyone. The femur is hard to break. It's the largest bone in your body. It's the strongest. It's supported by some of your strongest muscles, which contributes to that strength of the bone. And in someone that's younger, as in Brooke Shields' case, most commonly you injure it by something like a motor vehicle accident, something high energy, falling from a height, like it sounds like she did from what I've read kind of briefly online. So that's kind of how it happens. You know, how do we fix it? Well, it depends where the fracture is. In her case, I think it was a little bit higher up towards what we would call the head of the femur or the neck. And it looked like it had multiple parts, like 4 different parts that were broken or so. There's a lot to it. You can fix it from putting rods down the top of your femur, from the side of your femur. You can use plates and screws. It's not to be gruesome, but it's kind of like a home improvement project.
No, it's really is.
It's hardware.
Yeah,
fixing it, putting it back together, and how can we best do that?
Talk about that surgical procedure, because I'm sure the listeners going, okay, my femur's broken. How do they put it back together? How do they know where it is?
It is a puzzle. The big part is to get compression with bone. Compression of bone promotes the healing. So when you're looking at placing the screws and the plates, you want to figure out where that best will go to provide the compression to the broken pieces, if you will. And sometimes that's also done by a nail. Is kind of a confusing term. When I learned it, I kind of like to think of it more of a rod. It's a big long stick that goes through the hole or the bone canal that's relatively hollow. And certainly you also want to look at the recovery for a person. You know, when you're putting in a rod from the top part of your femur, you're going through the glutes, which will potentially add to your recovery time. When you're deciding on the plates and screws and such, the location of the break can influence possibly where the blood supply, if that's been disrupted. Right. So that's a really important thing to look at.
Right. It's an amazing process. What you do is, I find it fascinating. I mean,
me too.
Yeah, I bet you do. Extremely fascinating, because just a fracture of the femur, like you said, it could be multiple pieces. And in good hands like yourself, that fracture can turn out to be, that person can return to skiing, very functional, get complete healing. So the results are pretty amazing. You know what I like is, I like the fact that I met someone today in yourself, and I meet people all the time in Health Talk. That's what's so cool about what I get to do. Not only am I a physical therapist, but I get to talk to other collateral providers and collaborative people that, again, I can tell you want to help your patients.
It's awesome. It's great to know it's out there.
Yeah, really great to know. Great to have you on. I'm hoping we can have you back and talk in the future about some other cool stuff that you get to do.
Would love to. Thank you so much.
You've been listening to Mandy Warner, PAC in orthopedics at OPA Ortho, talking about the femoral shaft and the fractures with Shannon O'Kelly, and OPAOrtho.com has more information. Shannon, you mentioned how big the femur is and how complex it can be to get that thing mended.
Yeah, that's a huge bone, and it's large, and that shaft, when you fracture that, a lot of times they'll put hardware in there, bring those bones back together, compress that fracture site so it heals. I mean, it's a pretty significant and interesting process.
All right. Thanks again to Mandy. We'll be back with our final segment after this time out on Como.